we'll get them to 70. This is a story about a district. 25 schools in the district. In 2011, 3 schools came in and said, yeah, we're going to make a difference. We're going to make a difference with PBIS is going to come in and we're going to see, you know, behavior incidents go down. Well, 3 schools out of 25 isn't going to have that impact that we need to make that happen. But 3 years later, I have 8 schools. And look at it. The schools are all doing it with fidelity. And so we're seeing a little bit of something happening in motion here. Lo and behold, 2017, all 25 schools, whether or not they went through training, are measuring their fidelity of implementation of PBIS in that district. And you can see a great number of them are doing it above the line of fidelity. So they have nice partners there. So it's very strong. This district also put a focus on equity over the course of starting probably about 2013. And when we looked at their DERS data, and for those of you not in school, the Discipline Incident Referral Form, you can see the district data is the blue line, and the green line is the state line. And you can see the gap that they started with in 2011 and how they closed that. So they're focused on good implementation, where they saturated the district with that, and their vision for equity helped get them to some of these numbers. Kathy?
I have a quick question. Is that the Tier 1 CFI fidelity? Or
that one was just Tier 1. But those schools have also taken Tier 2 and Tier 3. They're just not part of that. And that's a good point, because if your Tier 1 is not in place, your other systems could implode on it. So that's an important thing. Now, what we've all been waiting for, the story of Van Dyke.
No pressure. No
yeah.
pressure.
You go ahead, Glenn. So I have been at Vanek Elementary School in Coleraine, Minnesota for the past 7 years as a principal. My children graduated from Vanek Elementary School in the 4th grade. I have 2 children that also graduated from the Greenway School District. So I've had a love for this school for many, many years. Over 20 years at least, I've had a love for this school, and was blessed to be able to join their team as a principal. They were a PBIS school before I came to Van Dyke. So as a building principal, I did a huge happy dance, because that would have been one of the things I would have wanted to move ahead, and they were already moving full steam ahead before I got there. Our school is in the county known as the School by the Lake. We are literally situated right on the beautiful shores of Trout Lake. Our students regularly hear loons in the summer and in the spring and the fall, and they get a chance to fish in the spring at our Trout Lake Day. We have a school forest that's adjoining, and so our kids are out in the woods all the time. We're actually tapping trees this spring. It was really fun. And we have a school garden, so we have a big focus on environmental learning. That tells you a little bit about the school from where it's situated. As far as our demographics, we have, at the time that this was sent in April, we had 393 students, kindergarten through 4th grade. We do have early childhood programs. If you've heard of the Invest Early program, it serves children birth through kindergarten entrance. We have sites adjoining in our local communities in Taconite, Marble, and also serve students at ICC in Grand Rapids at the community college. And so we have early childhood programming that complements what we do in the elementary. Our racial diversity is not real huge. About 12% of our students are American Indian, 1% Black, 2% Hispanic or Latino. Our biggest demographic at our schools, our biggest demographic difference is our poverty. And you wouldn't think that if you drove into town. You look at this beautiful little school on the lake, and you know, you think, wow, they have everything going great here. But in our community, we have a lot of poverty with the mines closing and just some of the issues, socioeconomic issues in our community, lack of jobs. We're at about 67%, almost 68% free and reduced. And the largest segments are free, not reduced. So it's a pretty poverty-stricken area. So let's see, this was last December maybe? I'm not sure exactly when this story ran in the Star Tribune, I can't remember off the top of my head. But Van Dyke was recognized as one of the 75 title schools. We're a school-wide title school that is beating the odds for students that are living in poverty in both reading and math, which we were pretty proud of, and I personally think is a direct connection to the work that we've done with PBIS, creating a culture of acceptance and support, and our partnership with our mental health supports within our school. I don't think that we would be having the results that we're having for our students if we didn't provide for them what we're providing for them, meeting them where they're at. In reading, we had 70% proficiency, and that's of our 3rd and 4th grade students combined. Our expected was 53%. We were predicted to, based on our poverty and our situation within our community, to only have 53% of our students proficient. So I think that's, for me, huge as a building principal, and tells us that we're going in the right direction. In math, we were at 80% proficiency, and we were predicted to be at 49% for our 3rd and 4th grade students. Just looked at our results from MCAs, which, you know what, when you talk about stress in the school, that's a big stress time. And it's kids that have experienced trauma or have lots of things going on at home, you pile on that stress. So we do tons of fun stuff to make MCAs special. We decorate, I mean, you wouldn't believe it, it's a party. We just make a party. But this year we're at 81% proficient between 3rd and 4th grade in math. Longer we dropped to 68% in reading, but we're still charging away.
And at the state, the math scores, they're not as high as the reading, so that's quite an accomplishment to have predicted.
And for those of you that know, the reading standards changed, and for our school, we had to totally retool everything that we were doing for reading. And so we took a couple of steps back, and then we lunged ahead to get them caught up. So, like I said, school culture, PBIS, our 3 R's are kind of the backbone of our expectations for students: readiness, responsibility, and respect. And you can walk down the hallway and ask any staff or any student, and they will be able to tell you at least 2, if not 3. I would say there are very few that can't tell you all 3, or know where the poster is where they can go and look for it. So it's pretty exciting. This past year, we have spent a lot of time training bus drivers. Bus drivers, our kids for some reason thought that our expectations for behavior ended when they got on the bus, that the bus wasn't an extension of the school. So we spent a lot of time working with bus drivers. We also are fortunate this year to have a Boys and Girls Club that has started in our district after school. And so we're working really hard to make sure the expectations from the school day flow into the after-school program. The playground is the same playground that you use at recess that you play on after school. So those expectations don't change. We're working hard with the Boys and Girls Club staff and with our students to make sure they understand that. The first year or 2 that I was at Van Dyke, we had all of the staff trained in responsive classrooms, and really believe that responsive classroom in a school with many of our students that have experienced significant trauma and live in poverty is really an important piece for their social and emotional development. And so all of our teachers start the day with a morning meeting and really work on a sense of connection as part of our school community. Green Lane School District has had an integrated mental health service in the schools for almost 28 years. We are fortunate that Children's Mental Health, a nonprofit agency in our county, had the foresight many, many years ago to realize that, students need support and that they're in schools a big chunk of the day. And so they began serving students. Greenway, actually one of our mental health staff has been in their building for 20 years. So she is now seeing the children of the kids that she's worked with. She knows the families quite well, so it works really well. We have services through the School-wide Mental Health Grant. We also have services outside of that grant where they're using, their private insurance or supports like that. So we have kind of a wide continuum of service that's available for students. We went through the PBIS training in cohort 5 many, many years ago. And school-age mental health staff are on our PBIS team. They're on our district PBIS team. They are on our RTI or MTSS team. They are a part of everything that we do at Van Dyke. The students see them as a staff person. They don't know that they're a mental health person. We have students that are not getting mental health support that want to go to the group that kid gets to go to, and they don't realize that, you know, it's a mental health group. It's just, I get to go to a group with Carrie, and they want to go too. So they're just integrated into everything that we do, into the life of our whole school. There's our 3 R's and our 3R hero. This was a couple years back, one of our themes. We were all the 3R heroes. We had Captain America come to school, and kids were pretty excited about Captain America. This last year we did a pirate theme. That was pretty exciting too. So the coordination of PBIS and school-age mental health, we track a ton of data. This year we have implemented a new system that really helps us track that data. I don't know if any of you are familiar with a data warehouse called EduClimber. EduClimber, I think, was originally out of Wisconsin, and we are now using that to track all of our behavior incidents. It gives us beautiful graphs, tells us where the behavior is happening. An example is we can say, okay, at this grade level, the #1 behavior issue is within the classroom, and #2 is the playground. We can really target specific strategies based on the location and the grade, also the time of day. And it breaks it right down to the individual student level. So when we're at our MTSS meetings every other week, we can take a look at what is the student struggling with? What are the triggers? Where is it happening? Is it happening in the cafeteria? What's happening right before they go to the cafeteria? Is it too loud in the cafeteria? We can really drill down and look at what are the concerns and how can we develop some interventions to support the student and the teachers. You know, it really gives them good information as well, how they can address some of the concerns. Risk assessments are something we started about 2 years ago, and that was a partnership between our mental health staff and our school social worker. They actually developed a risk assessment form because we had quite a few students. It was like a real uptick in kids that were saying, I want to kill myself, or I want to kill you. And so we use it for students that are making repeated homicidal or suicidal statements. And it's kind of surprising when you start collecting that data. It's also a really nice way for us to communicate with parents. Parents get a copy of that risk assessment and a conversation with either a mental health staff or our school social worker. So they are aware that their child is making those statements. And then we target interventions across all 3 tiers. We're working really hard on tier 2 right now. That's the hard one. So this is just an example of our fidelity data from Van Dyke. And you can see we haven't done any measuring of tier 3 with fidelity yet. We've been focused on tier 1 for quite a while. Now we're moving on to tier 2. We were so busy in the very beginning, you know, getting it up and going, that fidelity wasn't something we were really paying close attention to. And now that we are, we're seeing some big differences, and also able to influence that. Now that we have access to that tool, we're able to develop action plans. Our PBIS team has a very detailed action plan for every year, and we cross things off the list and move right through it. So
I would say somewhere in here is where you saw those proficiency scores that were represented in Van Dyke. So that would be a data connection across the school to make. Nicely done.
I'm not going to read it.
Do you want me to do this? Yeah. Okay. We went, the last time we went to Van Dyke, we did the tiered fidelity inventory with the mental health enhancement. So we were able to sit with their staff. We asked them the regular questions to see how it was going. But then we had a conversation regarding how this fit into their mental health profiles. So we had specific examples to team composition, professional development, classroom. The first one was the team composition, and you just asked, does the Tier 1 team have a coordinator, administrator, family member? What we ask for when it's the ISF, that's called the Interconnected System Framework, that's blending, that's short for putting mental health into the PBIS framework. So the question that they ask is, does the leadership team include a community employed and school employed staff with mental health experience? That was already on there. But if you're working with a school and you want to start embedding this, those are really good prompts. So that was a really great example for the team composition. The professional development, Van Dyke, like Sue said, they had a social worker and their mental health professional do professional development for staff on suicide and suicide ideation. So the staff had resources, and they knew, so school social workers in that day, or I could go to the mental health person, so it was collaboratively done. They do a lot of collaborative professional development is what we saw. And the classroom procedure. This is really important because we know most of the incidents of behavior happen in the classroom, but that last bullet, through professional development, teachers are more confident and competent to promote wellness and mental health. And we did the walkthrough at Van Dyke, and it was clear that every teacher that I talked to in a sampling were confident they knew who to go to if they had concerns. So that's been really covered well in that.
So the giving gift that you have is just the example that was put together for the grant, this past grant cycle. And when Mr. Potter, our agency director for children's mental health, asked me to put it together, I looked at it and I'm like, oh my goodness, we really took a lot of thought to put it together. It was a great exercise for me because on a day-to-day basis, I don't really think about how much we're integrated. And so to go through this document was really, it reinforced for me the power of that partnership. It was really a good process. Our early childhood program that I mentioned earlier also implements our 3 Rs, and they come to our kickoff every year. Our guests that are part of the kickoff go over and go to the classrooms and interact with the students. And when I go over to Marble and Taconite and meet with the students, I'm always talking to them about the 3 Rs, and so they're really familiar with that when they transition to kindergarten. I mentioned earlier we have a 21st Century Grant in our Greenway Boys and Girls Club after school. We're actually, thanks to Mary, going to be doing some coaching. We've been able to access some dollars to do some coaching for our after-school staff, and we just met yesterday with the director. And our teachers and paras are going to be going to the after-school program and working side by side with the after-school staff and helping them learn about the 3 Rs and the expectations. They've developed a matrix with the expectations that is very similar to what our students have during the school day, so it's a nice extension from their day. There's just a picture of our garden. This is actually one of the favorite places of our summer program. We have a summer program called REACH, and it actually is a site for multiple school districts, children to come in the summer, and they receive mental health support and social skills development all the way through the summer as part of the REACH program. They spend a lot of time in the garden, and they actually have snack in the garden a couple times a week with a nutrition educator, and in the fall, we pick all of the produce, and actually starting in late July and August, and bring it over to food service, and they use it in the spaghetti sauce and the salad bar and all kinds of fun things. So it's just a good salad bar. We have a good salad bar. So it's just another example of that partnership. And the staff that lead the garden activities in the summer are mental health staff. They're there and working with the students. So they kind of tend it for us all summer.
And then just quickly, because I know we're out of time, Chris, you want to talk about the school mental health?
So as we were talking about that give and get, that was part of the recent
application that came in for this recent grant process, and we're still in the contracting portion right now. Grants will end in June, next will start in July. We looked at a more regional coordinated at the local level approach, more outcome reporting on symptomology and changes in kids' symptoms, and a greater influence over the evidence-based practices and trainings that we're looking for therapists to be trained in as they're bringing those services out into our schools.
Just that this one, we worked together on this last grant, and we added in the a priority, if you were a PBIS school in the priority areas, and had schools and grantees completely given yet. Students being modest, make sure you look at those shared outcomes that were developed, as well as number 3, and it's how the schools, the grantees and the schools are going to work on PBIS together. And we look for scores of fidelity from the PBIS building. And here's where I knew something was happening. We were reviewing some of the grants, and I was reading a grant that said an applying grantee noted that their agency was participating in the person-centered thinking out of ICI. So someone going, an agency going into a PBIS building was now going to be trained in person-centered thinking, and this is a quote from their application. A commitment to person-centered programming through evidence-based practices at PBIS buildings has the potential to greatly benefit students and families through coordination and collaboration. And that's what we're hoping we're starting. Cohort 14 will start. We're looking at supporting districts, further collaboration with PBIS and schooling mental health so we can find other examples like Van Dyke, and integrating initiatives with our efforts. And we hope to do that through commitment, relationships, leadership, and understanding. I think that's it. Trying to get us out on time. And for those of you interested, there's a PBIS Summer Institute here in June 13th and 14th. If you're interested, let me know, and we can send you the information, or just go to MNPBS.org, and that's the website that'll have the information for registration. All right?